Welcome to NSG 227, Study Session 3, Position Used in Nursing. Introduction. Positioning a client in a good body alignment is an important aspect of nursing practice. A client assumes different positions in order to receive nursing care. Changing regularly and systematically provides adequate comfort at any position. Even the most comfortable one will become unbearable after a period of time. In this study session, you will examine the rationale of positioning, various positions used in nursing care, and the indications for each position, the general principles of positioning, and the articles necessary for positioning. Learning outcomes. When you have studied this session, you should be able to 1. Define the term positioning. 2. State the purpose of positioning. 3. List the different types of positions. 4. State the general principles of positioning. 5. State the articles necessary for positioning. Defining positioning. Positioning of the patient in bed can be described as placing the patient in good body alignment as needed therapeutically. Rationale for positioning. Positioning is necessary to promote comfort to the patient, to prevent complications caused by immobility, to stimulate circulation, to promote normal physiological functions. General principles in positioning. 1. Maintain good body mechanics. 2. Obtain assistance as required. 3. Ensure that mattress is firm and level of bed is at working height. 4. Ensure that sheets are clean and dry. 5. Avoid placing a body part directly over another to prevent pressure. 6. Plan a regular position change schedule for the patient for 24 hours. 7. Ensure patient comfort. 8. Wash hands before and after procedure. The types of positions in nursing. These are Fowler's position, supine position, prone position, lateral position, Sims position, lithotomy position, genupectoral position. Purposes: to relieve or minimize dyspnea, to relieve tension or abdominal sutures. Procedure. Nursing action. 1. Inform patients of the position and provide the needed explanation. Rationale. Understanding reduces anxiety, promotes relaxation. 2. Elevate head of the bed. Rationale. Increases comfort and relaxation. Fowler's 45 degree to 90 degree, semi-Fowler's 15 degree to 45 degree, high Fowler's 90 degree. Rationale. Increases comfort and relaxation. 3. Rest head against mattress and small pillow. Rationale. Prevents cervical flexion contractures. 4. Use pillow to support arms. Rationale. Prevent shoulder dislocation, promote circulation, and prevent flexion contractures of arms and wrists. 5. Place a small pillow at lower back. Rationale. Support lumbar vertebrae and prevent exaggerated flexion of vertebrae. 6. Place a small pillow or roll under thigh. Rationale. Prevent hyperextension of knee and occlusion of popliteal artery from pressure of body weight. 7. Place a small pillow under the ankle. Rationale. Prevent prolonged pressure on heels. 8. Place footboard at bottom of patient's feet. Rationale. Maintains dorsiflexion and prevents foot drops. Procedure. Nursing action. and rationale. After providing explanation about the procedure, place patients on back with the head of the bed flat. This reduces anxiety and promotes relaxation. 2. Place small rolled towel under lumbar area of the back. It provides support for lumbar spine. 3. Place pillow under head, neck and upper shoulders. It maintains and corrects alignment and prevents flexion contractures of cervical vertebrae and hyperextension of the neck. 4. Place strong canter rolls, sandbags parallel to lateral surface of thigh. It reduces external rotation of hip. 5. Place small pillow under thighs. It prevents hyperextension of knees. 6. Place small pillow and roll under ankle to elevate heels. It reduces pressure on heels. 7. Place footboard under the feet. It prevents plantar flexion or foot drop. 8. Place pillow under pronated arm, maintaining upper arm parallel to body. It reduces internal rotation of shoulder and extension of elbows. 9. If patient is paralyzed, place hand rolls in hand. It reduces extension of fingers and abduction of thumb. Maintain thumb in slight adduction and in apposition. Indications. 1. For patients with pressure sores, burns, injuries and operations on the back. 2. For patients after 24 hours of amputation of lower limbs. 3. Position for renal biopsy. Procedure. Nursing action and rationale. 1. After providing explanation about the procedure, roll the patient over with arm positioned close to the body with elbow straight and hands under hips. Position the patient on abdomen in center of bed with bed flat. It increases relaxation and provides proper alignment of the body, reduces flexion or hyperextension of cervical vertebrae. 2. Turn patient's head to one side and support with a small pillow. It reduces hyperextension of lumbar vertebrae and strain on lower back. 3. Place small pillow under abdomen before the diaphragm. It reduces pressure on breast for women and on genitals for men. 4. Support arm in flexed position at level of shoulder. It reduces risk of shoulder dislocation. 5. Support lower legs with pillow to elevate toes. Prevent foot drop and external rotation of legs. Reduces pressure of mattress on toes. Indications. Patients who require periodic position changes, e.g., bedridden patients. 2. In immediate post-operative patients to prevent the risk of aspiration, except in spinal and epidural anesthesia. Procedure, nursing action and rationale. 1. Provide explanation and prepare patients for the position change. Rationale, provides comfort and relaxation. 2. Lower head of bed as low as patients can tolerate and position patients to the side of the bed. It provides relaxation. 3. Turn patients to one side. In helpless patients, flex patient's knee that will be away from mattress. Place hand on that side to patient's hip and the other hand at shoulder, then roll patient to side. It prevents injury and trauma to tissue. 4. Place pillow under patient's head and neck. It maintains alignment, reduces lateral neck flexion, and decreases strain on sternocleidomastoid muscle. 5. Bring shoulder blade forward. Prevents weight from resting directly over shoulder joint. Indications: vagina and rectal examination, administration of enema and suppository, position for sigmoidoscopy and prostoscopy. Procedure, nursing action and rationale. 1. Provide explanation and prepare patient for the position. It ensures patient cooperation. 2. Place head of bed flat. 3. Place patient in supine position. 4. Turn patient onto lateral position, lying partially on abdomen. 5. Place small pillow under head and neck. It maintains alignment and prevents lateral neck flexion. 6. Place pillow under flexed arm, supporting arm level with shoulder. Prevent internal rotation of shoulder. 7. Place pillow under flexed upper leg, supporting leg level with hip. Prevent internal rotation of hip, maintains proper alignment. 8. Place sandbag parallel to plantar surface of the pendant foot. Prevents plantar flexion. Equipment or articles necessary for positioning. 1. Clean, dry, and firm bed. 2. Different types of mattresses. 3. Bed board. 4. Pillows. 5. Footboard or footboot. 6. Sandbag. 7. Hand rolls. 8. Trochanter rolls. 9. Bed blocks. 10. Overbed table. 11. Additional sheets. 12. Trapeze bar. Summary. In this study session, we examined the various articles and positions used in nursing patients. End of study session 3. Thanks for listening.